You want to dive, but you have all these questions. What may happen to me underwater if something goes wrong? What if I don't follow these diving rules? Hi, I'm Adam from Life Views. Welcome to our YouTube channel. In today's video, we'll cover most of the risks and injuries that may happen if the diver does not follow the scuba diving guide instructions. By the way, if you enjoyed the video and learned something new and you want to help us out, make sure you give us a thumbs up and you can always subscribe. So with that being said, let's get into it. Now, not everything about scuba diving is cool. As with any adventure sport, some risk is involved. Humans are not built to breathe underwater, which means that a diver is completely dependent upon their proper equipment, skills, and emergency training to ensure a safe resurface for every dive. This truth, while it may sound frightening, should not discourage you. However, it should encourage you to approach the sport with an appropriate amount of respect. Scuba diving is not dangerous as long as a diver seeks thorough training, follows safe diving guidelines, uses proper gear, and dives within one's experience level. As we said, as you descend, the pressure differences cause a squeezing sensation. You should stop descending the moment you feel a squeeze. Failure to do so may cause pressure-related injury or barotrauma. Barotraumas occur in scuba diving when the pressure outside your body is so unequal to the pressure inside your body that it causes damage to the diver's tissues. Barotraumas that may be caused by scuba diving include ear barotraumas, mask squeezes, and pulmonary barotraumas. Thankfully, barotraumas are easy to prevent in scuba diving. The moment you feel a squeeze, you should stop the descent. Ascend 1 foot to reduce the pressure difference between the water and his air spaces, and equalize your air spaces. During scuba diving courses, you will be taught how to equalize the air spaces preemptively, before any pressure or squeeze is felt. Doing so makes the chances of experiencing a squeeze underwater very low. Careful divers practice slow and controlled descents. It's harder than it sounds. And equalize their air spaces every few feet to prevent a squeeze and make scuba diving safe and comfortable. To prevent a squeeze in scuba diving, simply you need to equalize your body air spaces so that the pressure inside your body is equal to the pressure outside of your body. During every entry-level scuba diving course, you'll be taught those technicians to equalize your ears. Number 1. Pinch the nostrils gently and breathe out through the nose. Number 2. For your mask, exhale into the mask. Number 3. For your lungs, breathe continuously. Other injuries that may be caused by wrong scuba dive practice is number 1, ear barotrauma, number 2, pulmonary barotrauma, number 3, decompression sickness, and number 4, nitrogen narcosis. Let's take it one by one. With ear barotrauma, water pressure increases the deeper a diver goes. Your outer ears are affected by the water pressure, but not your middle ear. If you descend without equalizing your ears, the middle ear flexes the eardrum inwards, creating obvious pain. The discomfort felt as the eardrum bends inwards. It's similar to the feeling you have when an airplane takes off. So you must equalize the air pressure in your middle ear every few feet, or when you start to feel discomfort. To equalize the air pressure in your middle ear during descent, you must manually open your eustachian tube to allow higher air pressure to fill the middle ear. This is easier than it sounds. You can equalize their ears using any of the following techniques. Number 1, pinch your nostrils closed and blow gently through your nose. Number 2, perform a very gentle Valsalva maneuver by breathing against pinched nostrils and swallowing at the same time. Number 3, swallow or wiggle your jaw while keeping the regulator in your mouth. Swallow or wiggle your jaw. Pulmonary barotrauma. In your early steps in scuba diving, you'll be taught not to hold your breath underwater for any reason. If you ascend while holding your breath, your lungs could expand and explode as the air expands. This is known as pulmonary barotrauma. To prevent, never hold your breath underwater. Ascend slowly, don't dive with pre-existing medical conditions, and don't dive if you're likely to panic underwater. Following good diving practices such as monitoring your air supply to avoid out of air and low on air situations, practice good buoyancy, and properly weigh yourself to avoid uncontrolled ascents. Use well-maintained gear and dive with a good buddy who can assist you in any case of equipment failure or other emergencies. We also forgot to mention scuba diving is not an individual sport, as it looks like in fact it has a buddy system rule. That means you're going to dive in pairs, which means you and your buddy will take care of each other underwater. Okay, second last on the list we've got decompression sickness. Decompression sickness not only affects scuba divers, also aviators, astronauts, and compressed air workers. In fact, the term is technically more precise than decompression sickness, but it relates to the same condition, and approximately 1,000 US scuba divers suffer from it each year. DCS, as it is commonly known, is caused by a buildup of nitrogen gas in the bloodstream. When we breathe at the surface, approximately 79% of the air we're breathing is nitrogen. As we descend in the water, the pressure around our bodies increases, as we mentioned earlier, causing nitrogen to be forced from the bloodstream and into adjacent tissues. This process is not harmful, and it's entirely possible for the body to continue to absorb nitrogen until it reaches a point called saturation, which is the point at which the pressure in the tissues equals the surrounding pressure. The problem arises when the nitrogen in the tissues needs to be released. To remove the nitrogen slowly from the body, you must ascend at a slow, controlled rate and carry out decompression stops, which are called safety stops. By this measurement, you allow the nitrogen to slowly seep out of the body tissues and return into the bloodstream, where it's released from your body through the lungs. Decompression sickness happens if a diver ascends too fast. The residual nitrogen in the tissues expands too quickly and forms gas bubbles. This is similar to the fizz of carbon dioxide coming out of your soda. These bubbles cause joint and limb pain, dizziness and headaches, stomach sickness, a ringing of the ears, and in rough cases, red rash, often on the shoulders and chest in severe decompression sickness situations. You can avoid falling victim to the decompression sickness by rising slowly and taking breaks along the way so the gas has time to diffuse back out of the tissue and to be released through your breath. To treat decompression sickness, a diver must eliminate the nitrogen bubbles by undergoing recompression therapy in a hyperbaric chamber. I think we have to make a video about decompression sickness to cover it all. And now lastly on the list we've got nitrogen narcosis. Most people are always confused between decompression sickness and nitrogen narcosis. Basically because both are caused by nitrogen, although nitrogen narcosis and decompression sickness have very different symptoms and must be treated in very different ways. Nitrogen narcosis is an altered state of awareness. Basically, you are getting drunk underwater, and this is happening because of the high pressured nitrogen you are breathing in with every breath you take underwater. The deeper you dive, the higher the potential you will get nitrogen narcosis and the stronger you will get drunk. To treat nitrogen narcosis, you should simply ascend with safe ascent rate until the symptoms abate. As long as you feel normal, you can continue diving, but should not return to the depth at which you experience nitrogen narcosis. All of these conditions and injuries can usually be avoided with proper training and preparation and following scuba diving guide instructions. Now, there are diving computers that will calculate for you everything related to your dive and even give you alarms if you're exceeding some limits relating to time, depth, ascending and descending rate. Some of them will give you live feedback about your balance in your air tank as well. Lastly, let's remember the golden rules in scuba diving. Avoid pulmonary barotrauma, prevent loss of buoyancy, maintain breathing efficiency, and in your first dive, search for Nemo. So let us know in the comments section what you thought about this video and what you think we should cover next. Anyways guys, have a good first dive, and I'll see you in the next video.